with you. Hey, good evening, everybody. My name is Dr. Nathan Thompson with Exemplify Health Center, an affiliate of the Wellness Way. Happy Monday evening, guys. As we have some people joining on right now. And if you are watching, thank you very much for watching. Guys, please make sure that you share this video. I'm going to go over some really important things that will have to do with a majority of people, not only that are watching, but a majority of people in the United States. We're going to talk about tonight inflammation. Has your doctor tested these markers with you? And a lot of times, one of the tests that we're going to talk about is just a basic complete blood count with a differential. And I'm going to show you an interesting lab marker that they're using a little bit more often, and how if this lab marker is off, it's not just a lab marker, you have to do a little bit of math with it, how that can really determine chronic illness, inflammation, and even cancer survivability. So we're going to go over some really interesting things as well. And I might get a little bit excited too. I might get a little bit, I don't know, passionate. Maybe the word is compassionate, if you know what I mean. Only because as we always strive to get better, we want to, a rising tide raises all ships. And so I always encourage all people in healthcare to continue to learn, continue to get better, and never accept the status quo, especially when people say the science is settled. It's not settled, because science is actually never settled. So if you are watching right now, guys, make sure that you say hello and let me know also where you are watching from. We're going to go over some really, really awesome stuff tonight in regards to inflammation. So again, when you have an aha moment, hopefully you do, share this video with other people. Please share it as much as possible. And guys, you can go back and watch the replay of this video. Obviously, if you're on Facebook, but also if you want to ever see the long version of a lot of our videos that are archived, you can go to our YouTube page and you can see the long version of all of these videos. You can also go to our Rumble page, because we upload them both to YouTube and to Rumble, just in case we ever get knocked off of YouTube, which could happen obviously at any moment, which is fine, because we still have another wonderful platform known as Rumble. A lot of people, guys, when you ask questions, hey, what about this? Can you do a video on this? Chances are we probably have, and chances are you probably will find it on YouTube, or you'll find it on Rumble, or you'll find it on both platforms. So guys, make sure that if you are on YouTube or Rumble, please follow me on that, because we have literally hours and hours and hours of video about that. So, and I think that's really, really awesome. And we've been doing this for 3, 4, 5 years. So we have hundreds and hundreds of videos. And in fact, probably my favorite video that's on Rumble, because it got taken down within 15 minutes on YouTube, is Make Immune System Strong Again. And that we go over the immune system, and actually how to build an immune system response, and really what it means, and the things that we do that will knock down an immune system response. And then I answer all the questions about what's been happening over the last 3 years, and why a lot of things that people are asking me about every single day, why it hasn't worked, if you know what I am talking about. Okay. So I'm going to talk about inflammation, because a lot of times people they've heard the word, but they don't really know what it is. Because inflammation, quite honestly and quite simply, inflammation is a response of the immune system. And there's an interesting article, if you're watching on Facebook, if you're watching on YouTube, and this just came out. We're talking about within the last couple of days or so, March 18th, so about a week ago. The title of it, and this was in Cardiology Today, as reported from the Journal of the American Heart Association. The title of it is History of Infertility is Associated with an Increased Risk for Heart Disease. You find that interesting, right? And it just goes to show, because if you look at heart disease is an inflammatory issue that's going on. And I want you to think of heart disease is that the arterial lining gets very inflamed, and that basically, to make it oversimplified, is you have an inflammatory process. It's systemic. The arteries are inflamed. The arteries get damaged. And then the body then produces and lays down cholesterol in order to heal the damaged arteries. We blame LDL all the time. But then my question is what causes the LDL to stick to the arteries? It's not just some kind of random spackle or some kind of drywall paste. There has to be a mechanism for that to happen. And that's actually an immune response that causes the fatty infiltration underneath the arterial lining that we would know as plaquing. So what's interesting is you look at women that are suffering from infertility also now have an increased risk of heart disease. And it's not just, hey, this is just an incidental finding. If you actually think that and think about it and draw the conclusion that inflammation affects your hormones, that inflammation also affects your vascular lining, and you just draw the conclusion that maybe when it comes to hormones, maybe when it comes to my thyroid, maybe when it comes to heart disease, or maybe when it comes to cancer or weight loss resistance or autoimmunity, maybe the commonality, the common denominator behind that is inflammation. Don't you find that interesting? The only thing is that no one knows where it's coming from or what is causing it, and no one knows how to actually handle it. Because really, when you look at medicine, all they're doing is either treating the effects of the inflammation, i.e., cholesterol meds or blood pressure medication or hormone replacement like birth control or some kind of thyroid replacement, or they're then actually trying to knock out the inflammatory response, like when you look at autoimmunity and how they're trying to knock down the inflammatory process with corticosteroids or other immune modulating medications. And that they say, oh, by the way, this is going to take away your symptoms, but bad news is that you'll probably get cancer later on in life. So they're looking at infertility with an increased risk for heart disease, which leads me to this, guys, inflammation. So if you're from the Chicagoland area, and so many people say, hey, doc, I want to work with you. I'm trying to call the office. Guys, we have probably 100 people who call our office every single month wanting to work with us. And our response will always be the same. Hey, just please come to the inflammation talk. Because you will understand, if you understand inflammation, you will understand the first steps that you need to take. And this is the most important thing, guys, because doctor truly means teacher. And if we're not teaching how to take care of yourself, then we are doing a tremendous disservice for you. So at the inflammation talk, we're going to talk about the link the inflammation to weight loss resistance, cancer, autoimmunity, arthritis, thyroid issues, type 2 diabetes, autoimmune conditions, hormone issues, and things like that, and how inflammation, first and foremost, is the first thing that you need to address. And the reason why is that you're never, ever going to have a scab on your knee ever heal unless you first stop falling on it. So you don't treat the scab. The first thing you say is, hey, let's not fall down on our knee again. But a lot of people are walking around trying to handle or manage inflammation. But the reality is they just keep inflaming themselves, which is why they say, hey, maybe I should take a bunch of ginger and turmeric. And that's not the point either of trying to handle inflammation. So that's going to be Tuesday, a week from tomorrow, April 4th at 6 o'clock p.m. This is an in-person event at Exemplify Health Center here in Yorkville, Illinois. All you have to do if you're watching on Facebook is just go up to the very top of the page and you will see a pin to register for that via Eventbrite. If you're watching on YouTube, if you're watching even on Instagram as well, just go to in the bio, you'll see the Linktree link, and then you'll see at the very top, it'll say upcoming events, and you'll be able to register for the next one. And guys, the most important thing is once you understand this, and if you are coming into the office, you say, doc, I have no energy. And I say, okay, great. Here's the test that we need to get. You'll say, that makes sense. Here's why we need to test these things first and foremost. So guys, make sure that you get registered for it. I know that every single time that we do it, every 3 weeks, is that they're filled up. I think space caps out at about 20 people. And usually we are very close at every single one, which means if you don't get on this one, then you'll have to wait another 3 or 4 weeks. Okay. So let's get into it about inflammation. Everybody knows about it. Everybody has heard the term inflammation, but I ask people, hey, when you think of inflammation, what is it and what comes to mind? Very few people actually link inflammation to the immune system. They just think, well, something makes it get red, get swollen, and get hot. And that's how people describe inflammation. And that's describing acute inflammation, but people have no idea what chronic inflammation actually feels like. So I went over to the Cleveland Clinic, which is a well-respected medical organization. You have the Mayo Clinic, you have the Cleveland Clinic, which is probably one of the top two. And they asked the question, hey, what is inflammation? What is inflammation? And so here's what they say, and I'll give you my commentary on this. They say this: when your body encounters an offending agent, which means something has to offend the immune system. I find that interesting because I always say no one will ever change unless they're first offended. So encouragement works great, but a lot of times some of the things that I'll even say, yeah, they might be a little bit offensive. But just remember, no one ever changes unless they're first offended. And in fact, I tell people close in my circle, I'm say, tell me what I need to improve on, be honest, and offend me because I'll never change unless I'm first offended. So the immune system, first and foremost, must be offended. And what offends it? Well, things like viruses, bacteria, toxic chemicals, or when you suffer an injury, meaning there's been some kind of tissue damage, like a sprained ankle or a sprained knee or a cut on your skin. Okay. I'll add another thing in there, which is what they neglect, which is actually what Mayo Clinic is now starting to look into, is all of these things are either due to injury or due to the exposure to a foreign protein like a bacteria, virus, or a toxin. That's the job of the immune system, is to respond to proteins that don't belong within your body. Now, could this also include a food protein if a food was consistently not broken down the way that it was supposed to, i.e., low stomach acid, i.e., causing that would be stress or some other things as well? But then an unbroken down protein that is allowed to leak through the gastrointestinal barrier and get exposed to the immune system. Could that also cause an inflammatory response? And the answer is yes. So we have a bacteria virus. We also have a toxic agent injury, but it also would include foods as well. So what's the difference then between acute and what's the difference between chronic inflammation? What's the difference between the two? Because when I ask people about inflammation, most people just describe acute inflammation, which is good, which is needed, and which is necessary. But the response is an immune response to injury. Okay, so an inflammatory response is needed in order to initiate the healing process. So acute inflammation, guys, is actually needed. But we're actually taught that acute inflammation is bad. Even acute inflammation could involve fever. So we're told suppress the fever, ice the injury, but it's going to come down to whether you think the body messes up and makes a mistake, or if the body is smart and intelligent and actually doing the right thing. See, that heat is actually due to a secretion of what are known as cytokines that produces an increase in heat, and it also draws other immune system cells in order to continue with that inflammatory process. Now, chronic inflammation, here's what Cleveland Clinic actually says: chronic inflammation is when your body continues sending inflammatory cells even when there is no longer a danger. Huh, that's interesting. Because essentially, what they're saying is that chronic inflammation is unnecessary, not needed. And then when it becomes chronic, it's your immune system messing up. They also make this assumption when you talk about autoimmunity, saying that's just the immune system messing up, attacking healthy tissue. But remember, why would it work when it was acute inflammation as far as cleaning up damaged tissue, but then all of a sudden it can do that, but all of a sudden it doesn't know how to do it with autoimmunity? So there has to be something that's going on. And with autoimmunity, we always say it's not going after healthy tissue. And in fact, it's going after damaged tissue. It's just that it's unrelenting, it's systemic, and that most people don't like the result. And so they want to suppress it versus let's try to figure out the cause as far as why it's happening. So, what are some of the symptoms of acute inflammation? Well, a lot of you probably could describe that because you have flushed skin at the site of injury, i.e., redness. You get pain, you can get tenderness, you can get swelling, and you also can get heat. Okay. Chronic inflammation, according to the Cleveland Clinic, says, well, this may be harder to spot than acute inflammation because it's a lot more subtle. Signs of chronic inflammation include things like abdominal pain, like possibly bloating, for example, chest pain, fatigue, fever, chronic fever, especially things that go away and then come back, joint pain, like for example, rheumatoid arthritis. But if it could also happen with rheumatoid arthritis, can you also get joint pain that wouldn't be considered some kind of autoimmune reaction? The answer is yes. Mouth sores, skin rash, case of like psoriasis, uh, acne is also inflammatory reaction. So you can see a change in any single organ system, especially when it becomes systemic. Here's what's interesting. I want you to look at what they said about fatigue. Because if I had 100 people come into our office and I said, hey, what brings you into the office? 90% of them would say fatigue. And then this fatigue is my biggest concern. So everybody thinks it's their thyroid, everybody thinks it's adrenal fatigue. But guys, inflammation, chronic inflammation, is the number one reason for fatigue. And if you think about it, if have gone through the flu, if you've gone through an acute, bacterial infection, but think about if you've had the flu, well, you had fatigue. You didn't have the energy to go out and run a 5K. You wanted to stay in bed and you wanted to rest. An inflammatory reaction, one of the symptoms of it is, in fact, fatigue. So when people come in and say, I'm fatigued, I think it's my thyroid, I say, well, it could be, but it's probably not what is causing the fatigue. The fatigue, first and foremost, to handle is inflammation. So what's so interesting is you start reducing the inflammatory triggers and people say, wow, my energy is coming back. And I'm like, yeah, it's going to, because even if you understand the adrenal glands and you understand cortisol and cortisone and what the body does to convert that to make things more anti-inflammatory, you'll understand is that as it's converted to cortisone, cortisol is going to go obviously way down. And if you don't have a lot of cortisol, you're not going to have a lot of energy. You're not going to have a lot of energy to work out. You're not going to really want to get out of bed. And the body does that for a specific reason. So, what are some of the conditions, according again to the Cleveland Clinic, with associated with chronic inflammation? So, here's what's interesting: is that even the Cleveland Clinic says Alzheimer's disease, asthma, cancer, heart disease, rheumatoid arthritis, and yes, even type 2 diabetes. So if you looked at things like Alzheimer's, cancer, heart disease, type 2 diabetes, those conditions are some of the leading causes of death in the United States every single year. Now, there's a couple that are very high up. I won't mention that because I'll probably offend some people. But look at those different things and how they're tied to inflammation. They're tied to inflammation. So the Cleveland Clinic is talking about inflammation. And I agree that chronic inflammation leads to those things. But where we start to differ is how we handle it. See, they're looking for the next drug in order to handle Alzheimer's disease, or they're looking for the latest and greatest to try to handle the tumor and not the reason why it got there, or they're trying to find out the latest and greatest statin drug or cholesterol lowering drug versus trying to figure out why is that person inflamed, or they're trying to give the latest immune modulating medication in order to dampen the immune response with rheumatoid arthritis, but they're still not trying to figure out why that happens. It's the same thing with type 2 diabetes. What meds can we find that can actually force the pancreas to make more insulin, or that we can force more insulin into the cells? What are some of the latest things? And in fact, type 2 diabetes has gotten, so out of hand in some of the medications with it that now we have people who are taking type 2 diabetes medications just in order to lose weight, when we know that there is a very sound and sane way to reverse type 2 diabetes, and we lower people's blood sugars from type 2 diabetic, from diabetic or pre-diabetic down to not being type 2 diabetic. And we do that literally, guys, every single week. But here's what's interesting today is I met with a wonderful woman. She is still taking a statin drug, and we are testing her insulin response and her A1C and her blood sugars. And even despite, lowering her sugars dramatically, doing things in order to try to increase have the pancreas to heal, to improve blood sugar sensitivity or insulin sensitivity, to slow the sugars across the gastrointestinal lining. There's still one thing missing. And I had to tell her for the fifth or sixth time, as I said, looking at your lab, see, now you can see this, is that one of the medications is inhibiting the secretion of insulin. You don't have enough insulin while your blood sugars are still out of control. And that is a statin drug, a statin medication. And you can actually look this up and look at statin medications and insulin. Just type in statin medications and insulin, and even you see the first thing that will come up on Google is Stanford University saying, yeah, it inhibits the release of insulin and it worsens insulin sensitivity, makes you more insulin resistant. So even if your doctor is giving you a statin drug, they may actually be causing and exacerbating type 2 diabetes. So it makes you wonder, huh? So the Cleveland Clinic says, what are some of the causes of inflammation? Autoimmune disorders, where your body attacks healthy tissue. I disagree with that 100%, because the inflammation coming from an autoimmune reaction is not the autoimmune reaction. It's the body responding to trying to clean up damaged tissue. It just happens to be systemic. Exposure to toxins, which I agree with. Untreated acute inflammation, unresolved acute infections, things like that. Drinking alcohol in excess, absolutely. Exercise. Now, this was interesting. Exercising at maximal intensity too frequently, or you don't exercise enough. Okay. There is actually some truth to that. Because there are people who over exercise, who make themselves very inflamed. I have been guilty of that. And in fact, right now, I am so incredibly sore in my legs and in my lower back just based on what I did on Saturday. I did way too much. Of course, while you're doing it, you don't notice it. But I exercised too much and got very, very inflamed. But you also can be very inflamed by not exercising enough. That's why you have to find kind of a happy medium when it comes to exercise, not only for inflammation, but ladies, also for your hormones. You experience chronic stress? Yes, 100%. Or if you smoke, no doubt about it, because of all of the chemicals and toxins that you're exposing your lung barrier to every single day. So here's what the Cleveland Clinic says about how is inflammation treated. Okay. Now, this is where I disagree with this pretty much clear across the board, because here's the first thing on what they say on how you would treat inflammation. The first thing that they say is supplements. Okay. Supplements. They say, well, you can treat inflammation by taking certain supplements like vitamin A, vitamin C, vitamin D, for example, or you may take more zinc. So that's why when people say, hey, how do I handle inflammation? What supplements do I need to take? Or how do I lower my blood pressure? What supplements do I need to take? How do I lower my cholesterol? What supplements do I need to take? And many times it has nothing to do with the supplement whatsoever. Now they also say, for example, your healthcare provider may prescribe a fish oil supplement or vitamins. You may also use spices with anti-inflammatory properties such as turmeric, such as ginger, or garlic. Okay. Now, can turmeric help? Yes, absolutely. But if you never find the reason why you're inflamed in the first place, then the only thing that you're doing is dousing yourself with turmeric over and over and over and over again. And by the way, guys, this is one of the reasons why people may have heard of this, and why you need black pepper with your turmeric is because turmeric by itself is not very absorbable. So a turmeric powder, not very absorbable. Actually, one of the most highest foods in phytic acid content, which actually means that the anti-inflammatory properties are tightly bound. And so black pepper is actually what activates it. But if we're actually giving turmeric in our office, we are using it that's been extracted in an alcohol, because you don't need black pepper when it happens, and you'll actually make the anti-inflammatory properties that are in turmeric much more bioavailable. Okay. So you really shouldn't have turmeric powder by itself is not very good for you, especially. So they said, well, you can take supplements, you can take spices and things like that. Then they go into saying, hey, you can take non-steroidal anti-inflammatory drugs, NSAIDs, And so if you're having NSAIDs, then yeah, that's going to lower inflammation. But all it does is it just blocks specific signaling, the chemical signaling of the immune system, doesn't take away the tissue damage or anything like that. And then you have like steroids, corticosteroids, or steroid injections. So if you're talking about spine pain, for example, the doctors say, well, we're going to put in a steroid injection or a corticosteroid injection. And remember why is because cortisone is a derivative of cortisol. So it gets converted into cortisol in your body. Your body thinks that it's under a high amount of stress, which then lowers the inflammatory process. Because quite honestly, if you have a bear chasing you and you sprain your ankle, you don't want it getting swollen. You don't want to get red. You don't want to get inflamed because you still need to run away from the bear. So the body is smart. It's not stupid. And that's why high doses of cortisol has an anti-inflammatory effect. But one interesting thing they say is that you shouldn't have more than 3 or 4 steroid injections in the same body part per year because you're going to get a tremendous amount of bone loss. And this is why when people have autoimmunity and they're taking some kind of corticosteroid, this is why they will not have their whole fertility and menstrual cycle, things like that will go completely AWOL. And the reason why is because that cortisol, the body perceives that, the brain, the pituitary hypothalamus will perceive that as the body under tremendous amount of stress. Isn't that interesting? Tremendous amount of stress, which then influences your fertility. Ladies, think about that, how high amounts of stress influences your fertility. And also there's other stressors like overexercise that can impair your fertility as well. We've spoken about that too. So here's the takeaways from the Cleveland Clinic, a well-respected, medical organization, medical group, is that this is what we asked the question. Well, what about proteins from food? Notice how they didn't say anything about that, specific proteins from food. Number two, with acute inflammation, basically what they say is they say, well, it's supposed to happen, but you need to suppress it. Because how many times have you gotten acute inflammation and they say, hey, rest, ice, compress, and elevate? And in fact, guys, if you look at the whole principle of rice, you should not rest. Icing is only suppressing the inflammatory response that's needed to bring other cells there as well, and then to compress and to elevate. In fact, most people have heard of rice before, but that's actually never been proven within any kind of double-blind studies. And in fact, the person who came up with the whole rice principle said, you know what, I was actually wrong about that, but it just still continues because it's just tradition. It's no different than if someone said, yeah, don't go outside with a wet head because you'll catch pneumonia. You guys remember that? Or if I feel nauseous, I need to open up the car window and get some fresh air. That was actually the whole miasma, bad air theory of illness. And that actually came before we thought that we got sick from bacteria and viruses. But we know that's not true too, because if we all got sick from bacteria and viruses, then we would all be sick. But two people exposed to the same virus, one person doesn't get sick and the other one does, both of them got exposed. So what's the difference? It comes down to the strength of the host. So acute inflammation, they say, hey, it's supposed to happen. It's normal, but we still need to suppress it. But then when it comes to chronic inflammation, usually what they're saying is that the body's not supposed to do that. And it's making a mistake. So you need to suppress it. Okay. But the biggest takeaway that I'll say from the Cleveland Clinic is that the Cleveland Clinic, and for myself and within the Wellness Way, we all agree that inflammation leads to chronic illness. So inflammation is needed, but if you never, ever, ever get rid of what's causing the inflammation, then your body always makes the decision, I need to heal you now, even if there's going to be a long-term consequence. That makes sense. Now I need to heal. You can't die right now, even if this long-term inflammation, even if it leads to cancer, even if it causes your arteries to get clogged, even if it causes high blood pressure, even if it causes something with your hormones, I need to always handle this now. So it will always rob Peter to pay Paul in order to keep you alive. So here's the question I want to ask you guys is, could it be that healthcare has been looking at inflammation from the wrong perspective? See, all we do is we just look at the same thing, inflammation, but we just look at it from a different perspective. And maybe the reason why we are more sick, more chronically ill, and more inflamed than ever before with more autoimmunity, with more hormone issues, with more infertility, with more chronic pain, with more Alzheimer's, with more loss of energy, with more Parkinson's disease, chronic degenerative illness, with more ADHD, with more autism, with more reflux than ever before, is maybe when that's happening, we need to look at it, but we need to look at it from a different perspective. And I'm going to show you a couple of real cool studies to help you see this, hopefully, from a different perspective. Now, these are very, very recent articles. And this one actually came from Helio News, which reports on the most recent medical journals that are coming, coming down the pike. This one is from March 22nd, just 5 days ago. The title of it is Patients with Lung Cancer Depression Have Higher Inflammatory Levels. What's interesting about this article is they actually had said that depression causes the inflammation, and the more inflamed cancer patients were, the worse outcome they had with cancer. Okay. Now, here's what's interesting, because I don't want to look at it as depression is making the cancer worse. I want to talk about inflammation is actually what's making the cancer worse. But here's what's interesting is that they are looking at things like depression and how it impacts your health. And I did a live video probably about a year and a half, 2 years, maybe 2 years ago. And it was actually titled that COVID-19 lockdowns led to low-grade inflammation in our youth. So low-grade brain inflammation. How interesting was that? And it had to do with being under a tremendous amount of stress and how that led to low-grade brain inflammation, leading to things like anxiety and depression and things like that. And I reported on that, and I uploaded it to a specific social media platform known as TikTok. And by the way, I don't care if TikTok goes away or not. We have a tremendous following on TikTok, but I am fine if it goes away. It's one of the most sassiest, meanest platforms on the planet. But all I was reporting from a journal, and they took it down, probably because people didn't like hearing about that lockdowns actually work, because there were some people who absolutely fell in love with social distancing, lockdown, and draconian, measures, unconstitutional measures. People love that. It's almost as if they fell in love with their captors. I think we call that Stockholm syndrome. And they took it down and gave me a ding, said, do this again and we'll ban you. I'm like, okay. So here they look at this and they said, basically, when they looked at what's interesting in this, they looked at blood work. Okay. So they looked at blood work. They looked at actually common blood work that your doctor runs all the time. And here's what they did is they looked at a couple of numbers just from regular blood work. The first one that they looked at neutrophils, they looked at lymphocytes, and then they looked at platelets. Okay. The two measurements, and you can get your blood work out and look at this, is that they looked at what's known as the neutrophil to lymphocyte ratio, NLR, neutrophil to lymphocyte ratio. So if you go and you get your a CBC with a differential, and you will see these different types of cells. One of them is neutrophils. Neutrophils are actually responsible for bacterial infection, tissue damage, things like that. Lymphocytes are actually more responsible for things like viral infection, tumor suppression, and things like that. And then they looked at your amount of platelets to your lymphocytes, or PLR, platelet lymphocyte ratio. Okay. Now, here's what they found just by looking at the neutrophil to lymphocyte ratio. So predictors of poor overall survivor included this. If you had a higher platelet, a higher NLR, neutrophil lymphocyte ratio, and a higher platelet to lymphocyte ratio, basically what they found was that if your NLR was considered elevated, I'll go over what those numbers should be at, is that they actually had a poor by 91% poor survivor rate. If they had a high platelet to lymphocyte ratio, they had a higher poor overall survival by 2 times. And then, so when you look at that, literally we're talking about 100 to 200% poor survivability just by those 2 different markers. So what they found is that these inflammatory responses signaled a greater mortality, a greater risk for mortality with higher inflammatory levels than lower inflammatory levels. So basically, what they're saying is if you have low lymphocytes, high neutrophils, that is an indication that there's a lot of inflammation that's going on. And the higher that number went, the poorer your survivability of cancer is. And then if you saw a high amount of platelets compared to lymphocytes, so you might have elevated platelets, and you also may have a low amount of lymphocytes, which are responsible for viral suppression, cancer cell suppression, things like that. So you may have a problem with both of them. But they said is what drove those ratios up was actually inflammation. So what they're saying is your survivability of cancer has a lot to do with your inflammatory levels. So guys, if you get your blood work and you look at your CBC with the differential, so you can go, if you're from around here, go on your my chart, look up these numbers. So what should they typically be? Well, if you take your neutrophil count and then you divide it by your lymphocyte count, it should be at around 2. So even when we look at basic blood work, we're saying, yeah, it should be at 2, maybe a little bit higher than that, but you want it around twice as many neutrophils as lymphocytes. And then when you look at the number of platelets, when you look to divide it by the number of lymphocytes, it should be less than 150. So you're going to have a lot of platelets. What do guys platelets do? Platelets are involved in clotting. And when do you start developing a lot of platelets? When you are inflamed. So when we see people have high amount of platelets, we're like, yeah, there's some inflammation issues that are going on. And guys, really, when you think about it, you'll also see if people are inflamed, does that make sense now? Why their blood would be more likely to clot, or their blood would be more likely to be quote unquote sticky, which is why doctors will put patients on blood thinners in order to make the blood from not clotting as easily. So, but it's it's inflammation that's bringing those platelet levels up. So if you have, something that's greater than 2 from your NLR and something that's greater than 150 to your platelet to lymphocyte ratio, what does it mean? Two things: that you are highly inflamed and or you have a very low viral tumor response from those lymphocytes. So it can even mean immune exhaustion and high inflammation. And so you look at those and one can go up, one can stay here, or one can be here and the other one can go down, or they can actually do this. So you can look at this and really look at, guys, how inflamed that you are. And more doctors are looking at this. But we look at it at every single one, even if we're just doing basic blood work on people. So here's my question for you. Did your doctor discuss these test results with you on your last visit? I remember we had a patient who came in, had a massive neutrophil to lymphocyte ratio of about 9. Okay. So it was at about 9, which meant she was massively, massively inflamed. And in fact, the Mayo Clinic had been handling her case for about 3 years. And I'm looking through stacks and stacks of this CBC with a differential, and I'm looking at it, and I'm always seeing her neutrophils elevated and her lymphocytes not doing very good. She comes in, she's like, I feel bloated. My skin is on fire. You could tell she was swollen, red. She said, I can't lose weight. Please help me. I have no energy. And she had gone as far to go to the Mayo Clinic. And I'm seeing this ratio stay there for such a long period of time. And within about 6 months, that ratio went back down to normal, to about 2-to-1. The Mayo Clinic looked at this and they said, what on earth just happened? Because we have never seen this happen before. Why did this happen with you? And she said, well, I went to a chiropractor and we did this, this, and this, and it lowered it back down to normal. And she also lost weight. And then they said, okay, well, that's great, but you still need to do gastric bypass surgery. And because they said you won't be able to lose weight, you're going to need to do gastric bypass surgery, if you could imagine that. Just a sad, sad thing, trying to scare her into doing gastric bypass surgery as well, guys. But more money, obviously, in their coffers. So did your doctor actually review this with you, or did they just send you a note that says, hey, everything looks good, whatever, stay on your medications? Or did they say, well, one thing that you need to do is just, make sure that you get your booster, which is sad, but it's 100% true. But here's what's interesting, guys, is even if you look at that and you look at people with a high lymphocyte, neutrophil lymphocyte ratio, high platelet lymphocyte ratio, let me ask you a question. How many of those people that doctors never, ever, please share this video right now. How many doctors never looked at that ratio and told them to get a therapeutic for COVID, knowing they were already in a highly inflamed state, high platelets, possibly, and then insulted them even more with things that they put in their body? Because how many people that do you know that have been suffering with blood clots over the last 3 years? And if you have, please make sure that you leave that in the comments. So something to think about. Because even if you look at the Johnson and Johnson, within not a long time frame, they called it the clot shot. Okay, so but who was it affected the most? The people whose blood work probably looked like what I just described. Okay, now here's another amazing article. This comes from actually The Lancet, which is one of the most prominent medical journals that are out there. This is a recent article. It was published right in the middle of March. Helio News reported on it March 15th of 2023. So this is something that's very recent. But the title of it is Inflammatory Risk Better Predicts Events versus Cholesterol Risk in Statin-Treated Patients. So when they mean by events is they mean coronary events like heart attack, okay? Here's what they found. And again, this was in The Lancet. In patients at high cardiovascular risk, and they're already taking a cholesterol lowering drug or statin therapy, aggressive statin therapy, level of inflammation better predicted future cardiac events or death than their level of their LDL. And how many cardiologists have you said, we got to get your LDL under 100? Even better if we can actually get it below 60. I've even seen online some cardiologists say we should be getting it, your LDL down to 5, 10, or 15. And I'm looking at this and I'm saying, how on earth is this person supposed to make any hormones whatsoever, like stress hormone, cortisol, like testosterone, like progesterone, like your estrogens, because those are all based off of LDL. And so when someone says, oh, you can get it down to 5, 10, or 15, I shake my head and I say, okay, great. Then they're going to have awesome clear arteries, but they can't get out of bed and they feel lousy and they're going to have other problems going on. And this is the problem with healthcare, is that a cardiologist just looks at one thing, but then neglects what the effect that it has on the entire rest of the body. So in this, what they said is they said, we have people and we are aggressively trying to lower their LDL cholesterol. And one of the things that we found was all right, in this group, no matter where they were at as far as the LDL, if they were more inflamed, then they had a significantly higher risk of not only a heart attack, but dying from it, or all-cause mortality. So if you look at this actual research and statistics, again, from the Lancet, here's what they found. Here's what they said. Residual inflammatory risk was associated with incident major adverse cardiovascular events. Okay, so they took the people who had the highest. This is the marker they used: C-reactive, high sensitivity C-reactive protein, and they looked at who had the lowest high sensitivity C-reactive protein, and they actually found that those who had the highest amount of high sensitivity C-reactive protein, they had a 31% increased risk for a major adverse cardiovascular event. Now they took those same people, then they looked at cardiovascular mortality, those same people, and that actually went up 268%. And then they looked at all-cause mortality, not even necessarily due to cardiovascular risk, and that was 2.42%. So even though they lowered their LDL down to a certain level, those people who still had high amounts of inflammation were having anywhere from 2 to 3 times more risk of mortality. And that was due to inflammation. Inflammation. How interesting is that? Now, compared to their cholesterol levels, saying, well, we lowered it down in some people, we lowered it down to here in some other people, is that lowering it even more. So, lowering it to the lowest amount actually only reduced mortality by 27%. So 27%, and then all cause mortality between a little bit higher cholesterol and then lowering down, but negating inflammation, lowered it by 16%, if you can imagine that. So here is what Dr. Ridker, who was in charge of the study, this is a quote from him. Here's what he said. We have over 31,000 contemporary aggressively treated patients on high intensity statins or cholesterol lowering drugs. And the punchline is this: we are doing a very poor job at addressing this inflammatory response. And he admitted, saying we're giving people statins and we're still leaving them inflamed and they're still dying sooner. So here's the three conclusions that he came. And one of them I don't agree with at all. But the first one he said is this. He said, implication number one, if you don't measure C reactive protein, you have no idea what you're doing. That's what he's actually said to other doctors. He said, you don't know who in your clinic has residual inflammatory risk because you're not even looking for it. And that's just terrible medical care, and it's got to be fixed. I agree with that. Number two, he said, I've used CRP for years to emphasize the critical importance of diet, exercise, and quitting smoking. All three of these things lower CRP and cardiovascular risk. Now, so he's looking at this to say, how can we lower it on its own? But the problem is that specifically, if your doctor says, hey, I just want you to eat better and start getting 5 to 6 hours of exercise and stop smoking. Well, that's not very detailed health advice. That's not very, hey, come into the trenches with me and I'll show you how to do it. In fact, we even make it more detailed. We'll even show you exactly what's causing the inflammatory trigger. We'll work on doing those things because if you take these at a deeper level, you can reduce your C reactive protein on its own. And we've done that time and time again. And then his last conclusion, number three, is this. We are in an era where we have targeted anti-inflammatory drugs that have been proven to work. And that's his conclusion. His conclusion is statins and anti-inflammatory medications in order to lower that C-reactive protein. But just remember this, the only thing that anti-inflammatory medication is doing is it's no different than cutting out the tongue of a baby who's crying. It doesn't remove why they're crying. You just can't hear them anymore. So there's a difference between the two, which is why I never ever agree with number three. You have to always find the cause. But when it comes to number two, and then looking at the critical importance of diet, exercise, and not smoking, I'm like, okay, well, who's the best at doing that? And that's why I believe that our approach and the Wellness Way approach is always going to be the best because we are taking it at such a deep level. And we're also giving power back to the person to start taking charge of your health. And getting back into when you talk about heart disease, when you talk about plaquing, here's the thing. Inflammation is the cause and plaquing is the result. So it's kind of like this. It's kind of like if you go to a scene of the accident. Let's say, over the course of a month, you follow a crime or an accident scene investigator, and you go to 100 different accident sites. And so you go and you see the wreckage and terrible injuries. But every time you go there, you always see that there's skid marks. And that would be like you coming to the conclusion saying, well, after looking at 100 different accidents, one of the things that's consistently clear is at every accident, I saw skid marks. Therefore, my conclusion is skid marks cause car accidents. So what we need to do is we need to put Teflon on all the roads so that there cannot be any skid marks, and therefore all of these accidents are going to improve. There's not going to be any more accidents because skid marks cause accidents. But the reality is that those skid marks didn't cause the accidents. Those are what you see as someone was trying to avoid the accident. And this is why when you look at heart disease or cardiovascular disease, and you look at this and doctors open up and say, oh, it's full of plaquing. Therefore, we need to stop what's causing the plaquing. But remember, And their plaquing is there because of the inflammatory damage. So inflammation is the cause, and the plaquing is the result. And this new research that actually comes from the Lancet is actually solidifying what we've been saying for years, is that it's all about inflammation. So you have to understand, guys, what inflammation is. You have to understand where it's coming from. So if you look at high sensitivity CRP, which we measure a lot, okay, that high sensitivity C-reactive protein should be under 1, should be under 1. So let me ask you a question. Did your doctor ever measure high sensitivity C-reactive protein, or did they just say, just take your statin because that's going to take care of all of your problems? Number two, if they even did measure it, did they even try to find the sources of the inflammation? And then number three, did they ever give you any kind of individual guidance on how to lower inflammation? And we're not talking about the next thing, which is just say, hey, you know what? It's just all about your genetics, or maybe just try the Mediterranean diet, or maybe just start exercising more. And you go home and you're like, I don't even know what you're talking about. So, and the reason why people are frustrated with their doctors is they're not paid to give lifestyle advice. They are paid based on the number of people that they see. They're not paid based on outcome, and they're paid, with all of that. And I remember when we had our fourth child, Elias, it was in the hospital. The pediatrician came in, asked us two questions. How's things going? Good. How's he sleeping? Good. Feeding? Good. All right. Awesome. Well, you guys have a nice day. Was in for 2 minutes and then billed us $600 for it. And this is no joke. You want to know why healthcare is expensive? It's for that reason, that reason alone. So is that what they said? They gave you just the excuse of, uh, it's just genetic. You can try. Because remember, guys, if it is genetic, there's no use for lifestyle. But I want you to look at this lab result right here. Here's a woman who came in, C-reactive protein. This was even before hitting menopause, C-reactive protein at 3.3, and then as a follow-up measured it down to 0.4 or under 1. This was 100% based off of lifestyle. Dr. Nate, what did you do? Everything that we do is dependent on what we see on lab results, so everyone is different. There's no protocol, guys, and that should actually encourage you. I would actually say if someone is going around saying, buy my protocol, you should run from them, because in order for it to become a popular protocol, it really only needs to work on 20% of people. And I always say, even a blind squirrel can find a nut every now and then, which is why they say, well, this diet worked for me, it's going to work for you, or doing this worked for me, it's going to work for you. And you probably have found out it may not actually work for you, because everyone is going to be different. Everyone is going to be unique, which leads me to this, is we need a revolution in healthcare. And the reason why I say that, guys, is because when you look at us in the United States, we are more depressed, we're more anxious, we have more problems sleeping, we have more infertility, we have more obesity, we have more autoimmunity, we have more thyroid issues, we have more cancers, we have more heart disease, more type 2 diabetes than ever before. But the thing that woke me up, and I hope that it woke you up too, is look at what happened over the last 3 years. Look at what happened over the last 3 years. And this is, I think a lot of people are waking up, and I hope they are, to realize that we do need to change healthcare. This isn't a natural health versus medicine. This isn't chiropractors versus physical therapists versus medical doctors. This is put the people first as far as what's going to work best for them. Let's all get off our ivory towers and quit protecting our own brand and start doing what's going to work for the people the best. I get so frustrated because when people say, well, you're just a chiropractor. And I say, really? Then show me your labs. I'll show you my labs, and we'll see what actually works better. We'll see what works better. But when someone says that, all it means is I have no argument. So therefore, I'm going to have an emotional response versus having an intellectual discussion. And I see that happen all the time. And I was actually in a consult today with a gentleman. He's about my age. He came in and he was on statin drugs. He was on two statins. He was on three blood pressure medications. And we helped him lose about 40 pounds. He was able to get off of statin drugs, off of all of his blood pressure medications, felt great, felt amazing, got to the point every joint in his body hurt, and was able to actually start working out for the first time in 6 years and doing awesome and doing amazing. Here's what he told me. He said, the only doctor that was happy for me was my neurologist. My other doctors who put me on those medications, they were actually upset that I wasn't taking those medications anymore. And I'm like, are you kidding me? That I actually celebrate when I look at someone's labs and say, hey, you know what? You don't need to be on this, or this. Awesome. I'm so happy for you that we don't have to do much for you. And actually, our whole business model is I tell people, I don't want to have to deal with this with you twice. So let's work on it once and then stay well so that you don't need my help again. But what's interesting is this guy had an amazing story, yet I never had one doctor who called me up and say, tell me what you did, because I really, really want to help my patients get better as well. And I believe that in healthcare, we have overstressed doctors, we have intellectually lazy doctors who actually are more concerned about their paradigm than concerned about the health of the patient, which is why we're in this in the first place. And nothing has been more apparent than what has happened over the last 3 years. And this is the reason why I fight. This is the reason why I offend, is to get you to start thinking differently from a different perspective. And we need a revolution when it comes to healthcare. And if we're not, and if we're satisfied with where we are, then nothing will change and things will only get worse. And this is why every 3 weeks, why we do the inflammation talk, guys. It's Tuesday, April 4th, 6 o'clock p.m. And this is why we talk. Inflammation is really only the first step. But even with what I went over tonight, hopefully you guys get an understanding of how important, understanding of what inflammation is, what it isn't, but get an understanding too of how you need to get that under control. It's not about suppressing the inflammation, it's finding out what is causing it in the first place. Because if you find out what's causing it, guys, you won't be asking me about what supplements to take or what medications that you should be on. You will start to notice saying, at the end of the day, I shouldn't have to be on anything, because I know that the body is a self-healing, self-regulating organism that needs no help. It just doesn't need to be interfered with. And that's what we've been doing in healthcare over the last 100 years. And so if you're from the Chicagoland area, please do me a favor. Go to the top and get registered for that. You'll see it at the top of the page. If you're on Facebook, if you're on Instagram, you can go to our link tree in our profile, but get registered for that. Because when you truly start understanding inflammation, you will know the next steps that you're supposed to take, and you will understand why we have so many people who come to our office, not because we're good marketers, not because we advertise, but because of clinical results. And that's what we are obsessed with in our office. So hopefully, guys, you found this enjoyable. I appreciate every single time that you share, every single time that you comment. Guys, I hope you have a great rest of your week. I may jump on once or twice really quick to share with you. Just depends on my schedule. But I hope you guys have an awesome rest of your night, an awesome rest of your week. Be healthy, be well, and as always, remember who you are.